So the last question I have for you before we wrap up here is around B2C, B2B, B2B2C, right? So what were some of the things that you kind of wrestled with or contemplated around your commercialization strategy? You're in a multi-sided market, very similar to healthcare, right? Where there has to have that the B2B and the B2C involved.
Sure.
And I think that you guys have done a really good job at doing both well. So just talk about that a little bit for our listeners.
Sure. It's been an interesting, very steep learning curve, because there are some companies that we've mentioned, that do entirely advertising direct to consumer, which of course is extremely expensive.
Yep.
Because you're not only trying to build brand awareness, you're trying to convince them of something. We are kind of a hybrid model. We are advertising and working with doctors and dentists, many of whom, by the way, it takes some time to explain, because it's a new model and they don't quite understand it. And once they understand what we're doing, they think, well, wait a minute, this doesn't cost any money. You're sending me patients, you're paying me. This is no money out of pocket for me. This is too good to be true. I must be missing something. Almost sounds too good to be true. And that, honestly, I got to tell you, that's probably our biggest roadblock is in talking to dentists and saying, no, this isn't too good to be true. It's a new way of doing business. It's a little bit more risk for us, of course, because we're taking some of the financial risk. Yeah. But that's the bargain. You have to do at some point. But what we're finding is the direct consumer, speaking directly about marketing, direct consumer, actually, we don't have to do a lot of it to figure out what really works well. And what has worked well is a sale to the patients that we're going after, which generally it's parents of children who are aware that this direct consumer, if you want to call it that model, where you never have to see anybody, exists, but they would never trust that for their own kids or themselves. But they are aware that virtual treatment's possible. And so here is the perfect marriage of tradition and technology, where one visit gets them everything they need. And then with a minute or two with their smartphone a month, they can do their virtual checkups. So what we're finding is we can take that marketing and take it to prospective dentists that we're working with and say, look, this is what we're telling people. We have patients, potential patients coming into us now. I won't say in droves, but a lot. And, here's an existing patient base for you that we can link you up with and give them a service that you are well positioned to provide.
Sure. Yeah. And who's going to turn that down?
Who's going to turn that down? Right. Exactly.
Yeah.